We developed an engineering framework that allows the use of activity-dependent stimulation programs in rehabilitation settings, as well as outdoors. Physical therapists can fine-tune stimulation parameters with a handheld tablet that also provides real-time information on muscle activity, kinematics, and the occurrence of stimulation triggers, such as clicks from the patients to activate stimulation sequences. Patients use activity-specific stimulation programs outdoors to walk, to stand, and to perform recreational activities such as paddling on a lake, boxing, cycling, or standing at a high table of a bar for as long as 2 hours.